prior to pregnancy, but post-COVID.
Well, congratulations on the pregnancy and the new healthy baby. We're very excited. That's a really great "where are they now" story. That's what we like to hear.
Sure.
So after you gave birth, were you still experiencing, less symptoms, or did they start to creep back? Tell us how you're feeling.
So that's a good question. So throughout my pregnancy, I ended up, after my first trimester, I ended up just being switched to the regular OB because my symptoms were pretty much non-existent, and that continued throughout the pregnancy. I delivered in October, and in the first couple of weeks after that, I had a couple of symptoms come back up for maybe a day or two, but now here we are 4 months postpartum, and for the most part, I would say I only have I would say I have a pretty typical postpartum recovery, and I would not know that I have any other diagnoses other than the fact that I'm on medication. So it's been pretty incredible. Yeah.
Yeah, that baby did a body good. I love it.
Sure.
I love it.
That's exactly what the cardiologist at KU had kind of told me. He monitored me throughout the pregnancy and said, sometimes this might happen, and you kind of have to wait until after that 4th trimester, so about 3 months postpartum, to kind of decide, or for you to be able to see, did the body really recover well on its own, and did pregnancy act as sort of a reset for the autonomic nervous system? And so now we've reached beyond that point, and other than a couple of rougher days in that first 2 months, I think things are going very well. So
Dr. Comfort, when I heard the story, I thought, that is so cool. And Michaela explained it a little bit, what her OBGYN had said about the increased blood volume, but kind of dive into that a little bit more for us. Help us understand how that all worked out in her favor.
For sure. Well, first of all, so glad you're doing well, Michaela. Congratulations on the baby, and we're so happy you're feeling well several months later. And when we think about POTS, we think about it primarily as an autonomic nervous system problem. So that part of the nervous system that we don't have to think about, that controls our heart rate, our blood pressure, or whether we sweat or not, or something like that. But also a feature of people who have POTS is that they have lower blood volume. And so, as Michaela mentioned, when you get pregnant, your blood volume goes up 40, 50%, sometimes even doubling. And so we think that kind of counteracts some of the effects that people who suffer from POTS have.
So then talk to us about the connection between COVID and POTS, and the difference between, POTS. Is POTS the same as long COVID? What's the difference there? And then can COVID actually trigger POTS to happen?
Yeah, great question. So they're two different things. So, POTS has been around or been described for a long time. We've seen this. I've had several patients in my primary care practice, for example, that had POTS before COVID. And so oftentimes this is triggered by other viral infections, influenza, other cold viruses, trauma. People who are bedridden for a prolonged period of time can develop POTS. What we saw, though, during the COVID pandemic, during the height of it, is that there were a lot of people developing POTS. And so COVID is just one additional thing that can trigger POTS, basically.
Yeah, leave it to COVID to help us learn of something I'd never heard of as POTS. I think that was something new to a lot of us. And then talk to us, the P in POTS is for postural, like posture. So what is it about posture that can cause problems?
So our bodies are smart, right? So, when I stand up, gravity is going to try to pull my blood volume down. And I think they say about, 500 milliliters or so of fluid will kind of drop. But, we got to keep blood up into our head. And so our body has these reflexes put in place where it'll constrict our blood vessels to keep blood in our head. But also it'll increase our heart rate to increase that cardiac output to ensure that we have enough blood in our head. And so, for me, someone who doesn't suffer from POTS, my heart rate may go from 70 to 80 when I stand up. But for people who suffer from POTS, we've seen it go from 70 to 140 or higher, and so when that heart is really pounding away, it leads to a lot of these symptoms that Michaela was describing: lightheadedness, dizziness, fatigue, etc.
Yeah, when you explain it, it all makes sense. Michaela, tell us what some of the worst symptoms that you had. What do you remember most? Did you pass out? Dr. Comfort explaining some of these things that would have been really scary if you didn't know what you had. But what do you remember most that really concerned you?
So the worst time for me was the summer of 2021. So that was about 6 months after my initial infection, and I used a wheelchair for a month at that time because my dizziness was so difficult to manage. And so, like Dr. Comfort was saying, when you stand up, if you have POTS, your heart rate can go from 70 or something, and mine was shooting up into the 160s, 170s, sometimes even faster than that. And the blood was not catching up to my head or getting up to my head fast enough. And so I'd become super dizzy and unstable and start to pass out. And so getting up and down all day long when you're going from sitting to standing or laying to standing, et cetera, just led to so much instability that using a wheelchair when I was outside of the home became the best way to prevent me from passing out. Taking showers where I was standing for a long period of time, particularly in a hot environment, was also super triggering for that those blood pressure issues. And so I passed out in the shower a couple of times as well, which was super scary for all the obvious reasons. And there were the most difficult parts were earliest on when I was having chest pains to go along with all these symptoms, and I didn't understand what was going on. I could tell it was but we didn't know exactly what was happening, and it was my blood pressure, and the medications ended up helping with that. But when you're 29, 30 years old and having chest pains and difficulty breathing, and you're not able to stand up for more than like a few minutes without passing out, it gets very scary very fast.
Yeah, you're on beta blocker to help control your heart rate and your blood pressure, but you're also doing a lot of physical therapy. Talk about the physical therapy.
So I did physical therapy from June through August. So what's that, 3-4 months? I was doing physical therapy in the office twice a week. So it was relatively intensive now that I look back on it. Throughout the summer, and we basically started in a totally supine position, laying down and trying to just reteach my body that it's okay for my heart rate to elevate without having my autonomic nervous system to go completely haywire. So we would try to elevate my heart rate through exercise, but while laying down, and try to keep things managed and the symptoms managed. And then gradually, as that improved, then we started doing exercises while sitting up to kind of do the same thing. And then eventually we got to the point where we were standing up and doing exercises, and my body was able to better tolerate being in different positions, and my heart rate would still be able to stay stable, and my blood pressure would be able to stay stable. And all of those things led to appropriate blood flow and not passing out. So
Dr. Comfort, tell me, why is physical therapy so important for these type of patients?
Oh, it's critical. Yeah. So I mean, our therapists they do all the hard work, and they do the most important work, both for our POTS patients, but also for long COVID patients. There was a lot of overlap with that, and so, it's easy to get deconditioned when you feel this way, right? You don't want to be active and those sorts of things.
Yeah.
Our therapists can work with patients. They can do it in a very systematic way to get them back to their functional status. So they're absolutely critical in this.
Is POTS a lifelong chronic problem for someone, or will it just go away?
Yeah, that's a good question. So about half of people actually it just goes away spontaneously, whether we do anything or not, right? These things can help people get through that recovery quicker, but lots of people do improve. There is still a large percent of people who suffer from POTS long term, or it'll kind of come and go a little bit intermittently throughout their life.
Dr. Comfort, I saw you a bunch at the beginning of the pandemic, and as people were being treated in our post-COVID clinic. You're seeing fewer patients, which is good news, but tell us a little bit about how the COVID clinic came to be and kind of how it's evolved.
Yeah, so it was always intended to try to meet the need of the community, and we saw that there was a large number of patients suffering from long COVID, and so we set up a clinic or kind of a workflow to get patients access into those services. So it came into our clinic, and then we would try to kind of get people connected to our various specialists here in our hospital. As time went on, I mean, the need became very, very large, and so we needed more help. And so, the workflow now is that we've really kind of split this into a clinical pathway and into a research pathway. And so we've relied on our primary care clinics here at KU, which is growing every day, and we want have patients get connected into our primary care clinics, and then they get connected to pulmonary, or Michaela's case with cardiology and other clinics like that. And then we got the research shingles. So this is clearly something that we need to learn a lot about, and there's a lot of active research going on. Dr. Castro is the PI here at KU for the RECOVER trial, which is a large across-the-country, multi-center trial looking at patients who have long COVID, all to try to find out, learn more about this with the hope of having better interventions over time.
So not all long COVID patients are POTS patients, we know, but what other symptoms have we learned, anything new that long COVID patients are facing?
Yeah, so most commonly, long COVID patients, fatigue is the number one thing that we hear, and it's a very debilitating fatigue. I mean, people can't get out to go work or take care of their kids.
And is that acute up front, or are they still experiencing
many people
that 1-2 years
for,
out?
Usually, so most people's long COVID symptoms get better within a year.
Okay.
6 months to 12 months or so for the majority, but there's that small percent of people that are suffering for a couple of years or more. At this stage, we don't know how long that's going to go, but it can be for several years. So fatigue's a big one, shortness of breath, cough, ongoing pulmonary. When in our system, and we've done studies on our own patients, it's a huge percentage struggling from brain fog and other cognitive deficits, and so that's been a really big one that has really hit people, and it can affect basically every system of the body, though. So we see rashes, we see ongoing loss of taste and smell, we see you name it, chest pain, joint pains, all of it, and so.
Michaela, what's next for your health journey? I know you eventually want to get off those beta blockers, right?
Yeah. So right now, the plan with the beta blockers has been obviously to maintain those throughout the pregnancy. And now that I've delivered and I have a healthy baby, my blood pressure and heart rate have both been at a pretty baseline normal. And so at my next follow-up visit with the cardiologist, we'll start talking about trying to wean off and essentially see what happens. Like I've said, my symptoms have pretty well disappeared, but I am on the medication. So it's possible that without those medications, I might have some symptoms return, in which case we would just add them back in. But hopefully, whether it's with or without meds, I'll just be able to continue to make progress, healing from birth, and then getting back to an active life, and I'm able to start that very gradually, of course, but I've been able to do yoga again, which is something I really loved doing before COVID, but I couldn't do when I had POTS at the peak of it, because obviously there's a lot of postural changes in while you're doing yoga, and that would trigger, as soon as I would go to my first downward dog, I would start to get lightheaded and need to stop. But I've been able to do yoga since the middle of my pregnancy, and have been able to do a little bit here since then. I really need to get back into doing it more because I can. So now I'm just kind of figuring out what it looks like to return to a somewhat normal life. And obviously being so grateful that these changes have come with pregnancy, even though that was not necessarily a guarantee, because pregnancy certainly doesn't reset for everybody who has POTS. But I was a lucky one, and I'm really excited to be able to kind of see what else my body can do again now that I have mostly recovered.
All right, I want to bring you into this long COVID conversation. There was a headline that we saw yesterday. Forbes reports more than half of long COVID patients suffer from organ damage up to 1 year after COVID infection. That's based on a new study in the Journal of the Royal Society of Medicine. The study found that 1 year after a COVID infection, 59% of long COVID patients had mild damage to organs like heart, liver, and kidneys. What do you make of that?
Yeah, I think that's important to note. I think we've talked about the symptoms, long COVID symptoms, so what you're feeling. We've seen good data to support that, by 6 months to a year, and Dr. Comfort talked about this, really we are having a resolution of those symptoms for many, many people. But when you look at maybe the organs like the liver, where we can do some blood tests to look at that damage, or the kidneys, or even the heart, you may still have some maybe non-symptomatic or non-clinical evidence of disease or damage, but looking at that, we know that it's still happening. So it is very important. We are still learning about this disease in the acute sense, but also the long term.
Dr. Kupfer, what are your thoughts on that? Just that headline and what it tells us, everything that you've been learning so far?
Yeah, not terribly surprising, honestly, and kind of scary if you think about it. But I think it's another layer that we're learning about this. I think we really have to understand the biological mechanisms of this disease. This adds to that. And then hopefully over time that leads to targeted treatments. Right now we're really relying on physical therapy, occupational therapy, other kind of symptom-based treatments, like what Michaela was getting and things like that. But we really want a targeted treatment going after that biological mechanism.
All right, let's see if we have any reporters on the line. Let's get to our community questions today. So Marcy wants to know, how do you know if you have POTS and that it might not be something else?
Yeah, it's a good question. So, the symptoms, Michaela highlighted those really, really well, right? So you may feel dizzy, you may feel lightheaded, you may feel your heart kind of pounding out of your chest. It just feels like that. If you're having those symptoms, what I would do is go to your primary care doctor. The first thing they're going to do in the clinic is they're going to check your orthostatic vital signs. So they're going to have you lay down and check your blood pressure and your heart rate, and they're going to have you sit up and they're going to have you stand up. And that alone can give us a pretty good indication of whether or not somebody has POTS. If that's negative or something like that, then we can kind of start looking into other things. But if you're having any of those symptoms, contact your primary care physician.
Katie wants to know, could POTS lead to a heart attack?
No.
No.
It's a totally different mechanism, and so there's really no increased mortality or with people with POTS. It's certainly debilitating, but it doesn't lead to a heart attack.
Okay, Yvonne wants to know, Michaela, did anyone not believe you or not understand your POTS? I think you mentioned that was the case. I know you were thrilled when somebody finally did believe you, but what was it like trying to explain this to people?
So in the this is about a year after the pandemic started, and so people were just starting to talk about having these symptoms longer term, and what it would look like, and all of the focus at the time was on people who were immunocompromised, or maybe people who were already older, had some other kind of health issue that predisposed them to something else. But that wasn't me. I was 29, 30 years old, perfectly healthy, and then all of a sudden using a wheelchair. And I got a lot of looks from people who didn't understand. And maybe they weren't actively not believing, but they were certainly not understanding, because you looked at me and I didn't have a broken leg or something. And sometimes people don't understand that invisible disabilities can still be disabling in such a way that you might need a mobility aid. And that was more in like the general public sense. I was very lucky that the doctors at KU did not have, or they always believed my symptoms, and it took a little while to figure out exactly what they were pointing to. Just a couple of months, honestly. It's not a long time in the grand scheme of things. But in general, people would often say, oh, you're having chest pains. Maybe you're just anxious because this pandemic is so stressful, or, something to that effect. And they would really struggle to understand just how difficult it might be to not know if every time I stand up is my heart rate going to skyrocket and am I going to pass out. And when you think about the number of times as an active person, when you're moving your